Hi, I'm Fred, head coach at USULI. Welcome to the Epic Endurance podcast, where we take a deep dive into endurance, strength, and conditioning. Today, we want to talk about HRV, or heart rate variability. HRV is a very useful metric for assessing recovery along with resting heart rate, and I want to explain what it is and how it works. First things, there are different ways and different numbers when we're talking about HRV. There is SDNN, which is the standard deviation norm to norm, I believe. And then there is something called RMSSD, which is the root mean square of successive differences. They basically look at the same thing, which is a variation of the time it takes between two heartbeats. So if your heart is beating at 60 beats per minute, let's say, it does not beat exactly one every second. There is going to be a bit of play. And this play is a direct reflection of the activity of your vagal system. It is not a correlation, it is directly affected by your vagal system, which in turn is basically telling you if your body is in a stress mode or if it's in a relaxed mode. HRV values tend to be subjective to one individual, and changes in number may indicate more stress or less stress, but sudden changes usually are not a good thing. There are many things that can make your HRV training down, that can be overtraining, underresting, environmental stress, so family, work, lack of sleep, waking up in the middle of the night, alcohol, too much. Now, sometimes taking a bit of alcohol might actually increase HRV. Again, it is very, very individual, so it will depend from one person to another. Just even stressing about things will decrease HRV, and again, that showcases that you are in a fight or flight response. Your sympathetic system is activated. Interestingly enough, you can also monitor HRV during training. That is to say, if you were to measure HRV during a training session, when you reach higher intensity, your HRV will go lower as you are subject to more stress. If you look at an unsmoothed chart of your heart rate at higher intensities, then you can see the variation even on the graph between heartbeats is getting lower and lower for two reasons. One might be because the HRV is diminishing because you're in a stressful situation. It might be a good stress, but it's remain a stressful situation. And second, also because you're approaching your anaerobic ceiling, and therefore a lot of your energy is not coming from the aerobic system, and your heart rate is not the primary motor driving the mechanics. You're already unable to utilize the oxygen it's providing. The heart rate is going to continue trending up a little bit. It's going to try to improve blood flow, probably increase sedation rates, make you sweat a bit more, but your capacity of handling oxygen is limited, so your heart rate will not keep on trending up all the time. So HRV and this anaerobic ceiling are both going to showcase less and less variation at certain points. When we see HRV trending down or your resting heart rate trending up on a day-to-day basis by more than 5 heartbeats, and HRV having a trend downward, usually a sign of increased fatigue, potential sickness, maybe a good time to take a rest or lower the intensity of your training. If, for example, you have a very high intensity training session and in the middle of the night you're not able to sleep for a couple of hours, and your HRV in the morning is going to be pretty low, your cortisol is going to go up during the night, which is going to affect a lot of things, the way you deal with sugar, the way you deal with everything. It might be a good idea to reduce the intensity of the session, or potentially to swap the session for an easier session to make sure that you do not go above the red line. We said that HRV is subjective, but HRV changes as you age, and it tends to go with lower value. There are differences between men and women until 50 years old, and then the values kind of even out. Your watches, or Garmin watches, will mostly look at RMSSD value. Again, there are other ways to look at this, and there are applications that might give other numbers, but usually SDNN and RMSSD are the two values that are being expressed. These are expressed in milliseconds. I will just try to give you a small table with norms comparing young adults and older adults. For young adults, I mean people that are in the 20s and 30s, and then older adults, usually people that are 40, 50 and above, and then young athletes and what is the range also for general healthy adults, which is a big range, but and then again, the goal is to try to improve your HRV values over time if it's possible. There are ways to do that. Breathing techniques can improve your HRV values. When you do controlled breathing, you can actually increase your HRV. There have been studies showing that low HRV chronically has both negative impact on the physical and mental health, because if a person is always under constant stress, then mental health takes a hit. So if you're always exposed and your body and your mind is always on a flight or fight response, then mentally you get exhausted. That is normal. HRV also correlate with other things. Chronically low HRV can correlate with a higher rate of mortality, cardiac events, longevity in some ways, because HRV also can correlate with your VO2 max. People that have a higher VO2 max tend to have better HRV scores than the norms. It can correlate with metabolic function in the same way. So again, we're talking about correlation, but the correlation is pretty strong. And because personally, low HRV also correlate with higher inflammation rates, then it can correlate with the entire body organ health. So how your organs are resisting with inflammation. The inflammation can be a good thing in a certain time, but chronic inflammation is never a good thing. Because HRV is a very strong and a direct representation of your rest and digest, your parasympathetic system, and your flight or fight response, which is your sympathetic system. These things affect your entire health range: physical, the emotional, and the mental health, anxiety disorder, depression, your own resilience to pain. All of these are going to be affected. If you do day-to-day monitoring, that you can see your HRV values will change during the day. Normally they tend to raise up during the night and then degrade as the day passes if you're having restful sleep. If not, then they might just not be very, very high during the night, but actually improve during your days. That really depends on your lifestyle and what is happening in your life, but they are, like we said again, I'm repeating myself, a direct representation of your stress and your body. And that also means that some of the energy systems that you will be using, the amount of cortisol that your body is carrying, are going to be affected by these values. And it's a pretty easy thing to check. So things you can do to improve HRV, probably one of the goals of this video. First, avoiding overtraining and avoiding all the things that we say can push you to this fight or flight response. There have been multiple studies and meta-analysis that have shown that 8 to 12 weeks of aerobic training can increase your HRV values while lowering your resting heart rate, especially when you are training at correct intensities and avoiding the zone-free pitfall where people train a little too hard and never do very easy work or very hard work. Thing you can do number 2 is consistent quality sleep. So believe me, this is not very easy, especially this moment for me, but having your 8 hours of sleep with plenty of REM sleep, with plenty of deep sleep is going to improve your HRV values. I know that there are some individuals that have been found to thrive on shorter duration, but the consensus for 99% of the population is getting this amount of hour will be a good thing, because this is the time where your body is actually making improvement and recovering. This is your sleep is made for that. Stress management techniques, that may be through meditation, through yoga practices, mindfulness, all of these can improve your HRV. I personally really like HRV biofeedback or HRV monitoring and breathing exercises where I can see in real time HRV score improve as I follow a tempo breathing, very slow and controlled breathing. Now you do have different kind of breathing technique. You can do box breathing where you breathe in and you hold, and then you breathe out and you hold, and you breathe in and you hold, and you make a box like this, or just slow breathing in and then slow breathing out. This tempo is usually slow. I think for most people, the mean line is about 5-ish seconds for one exhale and 5 seconds for one inhale, but it varies. And again, it is possible to test for this with certain apps where you can see what kind of breathing has the strongest impact on your HRV, which is pretty good. I strongly recommend doing things like this, as this induces a very strong state of relaxation, which is monitored in real time. This kind of breathing technique or deep breathing is also done with people having anxiety or panic attack, people that have issues, for example, going to swim or have aversion to doing certain things. When being overly and exposed to stimuli, not being able to cope. Learning how to regulate breathing can affect the whole chain and then induce relaxation and lead to better outcomes. Avoiding heavy use of alcohol and tobacco, these are known to decrease HRV scores. I mentioned that in some cases, in my case, I know that if I have half a glass of French red wine, I have always seen that my scores tend to be much higher than if I had nothing. If I had more than one glass, then they plummet. I don't drink every day, I rarely drink, but again, this is something which is personal. But at the end of the day, these are stresses, and the outcome in the majority of the case will be a decrease in HRV scores, showcasing again an increase of the sympathetic system, this stress response. A healthy diet rich in omega-3 fatty acids that are anti-inflammatory. But having a good diet is important. Healthy diet, whole food, plant-based diet, having a majority of your nutrient coming from plants always lead to better health outcomes. You like meat, you can have meat. Weight loss can also improve HRV. So weight gain does decrease HRV as stress is increased in the body. Going closer to an ideal weight, so you can look at BMI ranges or having a target in a healthy body fat percentage. When you're going to these scores, then both your VO2 max and relative VO2 max are going to be improved, and stress in certain ways is going to be improved. Now, we'll talk about this, but for a lot of athletes, an increase in weight is not always due to excess calories. Sometimes it's due just to improper eating and nutritional strategies. I've seen and I often see many athletes suffering from undereating and then slowing down their metabolism, and their metabolism is in a crisis mode, and then basically it tries to take in whatever is given through a stress response, and in this case, of course, HRV is going to go down. There are no medicine that directly are meant to improve HRV, but there will be pills or medicine that will have an effect on HRV indirectly. Beta blockers and all this. The goal, I don't recommend taking on this to artificially change your HRV scores. But if you do take certain kind of medicine, they might affect the way the vagal system is acting and therefore change how your HRV is behaving. So if you start taking medicine and then you see a sudden change in HRV, there might be some correlation between the two. It's good for people that are chronically taking certain medicine just to compare the score to themselves and see how they trend over time. There is moderate evidence that therapy can also increase HRV scores. So we're talking about CBT, cognitive behavior therapy, can relieve some stress. These therapies are often used to reduce panic disorders and are often done in conjunction with breathing exercises. And like I said, there is moderate evidence that these kind of therapies can improve HRV scores over time. If you're wondering about your Garmin devices do use RMSSD and not SDNN, which is the root mean square of successive differences. RMSSD is usually easier to measure from a short duration, like a 1 to 5 minutes time interval, and like when people are not in movement. So it's often taken on your Garmin devices in the morning, or you can use your Garmin to say taking a health snapshot, and then it will measure your HRV while you are at rest and ask you not to move for 2 minutes, and then you can have an HRV score. When using HRV tracker, it's important to understand that if you change from one tracker to another, you might have slightly different scores. It might be because of the way the score is calculated. Usually RMSSD is the same as RMSD in different devices, but acknowledge that there might be differences. The importance is by using the same input, looking at the quality of your result over time and mostly monitoring trends rather than absolute values. Now, the values I've provided before might be a good reference. So again, I encourage you to use HRV on a day-to-day monitoring with your training. It's a good way to prevent overtraining. It's a good way to know when to call it rest, especially after very hard session. And it's a very interesting value. And that will be it. I hope you have a great one. If you have any question, please feel free to contact me. Bye.